It's time for DocTalk Radio, brought to you by Gilbert Hospital and Florence and Anthem Hospitals. I'm Dr. Ann Borik, board certified in internal medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to DocTalk Radio. Joe, how are you today?
I'm good. How about yourself, Dr. Borik?
Good. It's good to be back in the studio.
Yes.
Yeah, last week we did it was a neat opportunity to check that out.
That was, it was a great show, too.
Yeah, that's good. I'm going to actually talk a little bit about some questions that we didn't get to starting today. But I just want to let everybody know that this show is sponsored by Gilbert Hospital and Florence Hospital at Anthem.
And I want to just take 1 second to say I want to thank the hospitals, Florence Hospital at Anthem specifically, for sponsoring the fantastic casino night out at the Holiday Inn Express in Florence, put on by the Chamber of Commerce. It was fantastic.
They had a great turnout.
You know what? It was way, 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 way better than they ever thought it was going to be. They said they thought for the summer maybe 100 people.
Right.
They had over 3.
Wow. That's great. In the hospital, I mean, we're just starting to really get busy, and things are, really going well. So it's exciting to be part of it. Yeah.
It really is. I feel the same way.
That's neat. That's good. For those of you listening, I want to just talk about last week's show. We had Dr. Ray Budway on the show, and it was a great show. We had lots of calls, lots of questions, and I want to just kind of open up today with just kind of following that thought process of steps to help prevent breast cancer, because this is something that I try to live by, and I really want people listening to kind of hear it. So I'm going to go through, just a few steps and a few numbers that have been proven clinically from a research standpoint that have been found to decrease the risk of breast cancer.
Do we want to put it out there for people to start calling in, or do we want to
Absolutely.
go ahead and...
Let's open it up. I'm gonna talk about this, and then today's a show that I have a few things that I want to talk about, but I would love to hear from our listeners. Let's chat, let's talk. If you have anything on your mind, call in. I'd love to hear from you. So that's
and
good.
You could do that at 480-745-1033. And if you're on the watch now rather than the listen now, you can just look right at your screen, and I'll see if I can't put that number up.
Okay, that sounds good. Yeah, that's great. So number one, body fat. Weight loss is absolutely vital. As people increase weight, gain weight, that increases the risk of breast cancer. And last week, Dr. Budway talked about, we were talking about the highest risk is in the 50, once we reach the age of 50. So anybody in that perimenopausal time in the 50s, try to really be cognizant of your weight, because as we gain weight, it increases the risk of breast cancer. That's number one. Number two, alcohol is probably the most proven risk factor for breast cancer, and a lot of times we don't think about that. We hear the health benefits of alcohol and for the heart and red wine and all of that, but I want to make sure that the listeners out there understand that more than one drink, 2 to 4 ounces of alcohol a day, greatly increases the risk for breast cancer, like by 20-25%, according to one particular study out of Harvard. So that's a risk factor.
Do you know why?
Joe, I don't. But we do know that there is a high risk, but I don't know exactly the pathophysiology or why that is. But we do know that it is. And there's so much research looking at breast cancer these days, because it is prevalent and it is something that we want to eradicate. I would love to see breast cancer disappear from the face of the earth.
Absolutely.
And I think that's why the Susan G. Komen, and there's just so much research and good stuff going on.
And it's hard to know what to believe. I read a lot of magazines, and it seems like every other day I'm reading a magazine that says there's a cure for cancer.
Right. And what I'm telling you are really modifiable risk factors that have been proven. So increasing weight is not good. Alcohol, we know, more than one drink a day is not good. We also know that eating more fruits and vegetables are protective for the body.
Now, the question I have about that is, when you cook them, does that get rid of the value?
That's a great question. And I got to tell you that sometimes it does, but sometimes it doesn't. For the most part, from a breast cancer standpoint, the most beneficial, probably the super vegetable, the superfood for the risk of breast cancer, is the cruciferous foods, which is the broccoli,
spinach.
Well,
is that right?
It's actually more broccoli, Brussels sprouts, cabbage.
Never heard of cruciferous.
Yeah, that's the family name of like the broccoli type, and when you overcook those kinds of foods, you lose some of the nutritional value. So that's a really good point.
So is it better to juice?
Not necessarily, no. There's no one better or not, but from a standpoint of eating those fruits and vegetables, it is vital that we increase it to probably, we're touching, probably 7 or more servings a day. And that's
Wow.
very, very important for people to know, to get the health benefit from it. So,
And supplements aren't not even close to the same, are they?
not necessarily. Now, supplements are important. Antioxidants, multivitamins, that's going to be something on the list as well. But we've got to eat more fruits and vegetables. That is really vital. Exercise regular for the rest of your life. That has to be a message out there for anybody that's interested in decreasing risk of breast cancer, period.
Just got a really nice elliptical machine.
Good. Well, for you, that's
For
great.
my wife
For
and
your
me.
wife, absolutely
So-
vital. And for the listeners out there, it's not necessarily about intensity of exercise. It's more about consistency. Walking, go out for a walk, 5-6 times a week. I mean, just kind of get up and move. Just by movement increases that benefit. So just keep that in mind, that exercise is absolutely vital for people. Omega-3 fats. We know that the nuts, those kinds of foods, fish, salmon, tuna, those kinds of things are beneficial, protective for the body. So these are just some of the things that I wanted to kind of throw out there. We know that estrogen is not good. We talked about it last week, that some of the supplements are something that we don't recommend. But be aware that pesticides and some of the chemicals that are found in the in our environment, we've got to try to be aware of. Deodorants, for example. We oftentimes recommend going to more of like a natural type of deodorant for women, just to decrease that exposure to what's called the xenoestrogens.
It's funny that you say that because there are certain types of deodorants. If I use them, I get these like almost like a pimple, but big, like a cyst
Right.
under my arm. It's really, really awful.
What happens is it kind of you have sebaceous kind of glands. And sometimes deodorants can clog that, and it can set you up for an infection. And we see that a lot of times. People come in with these boils or infections that under the arm is a moist, warm area, and that's a perfect scenario
And they hurt.
for infection and bacteria to grow. And so you've got to be careful of that.
Got a comment out there from a chatter that says, you can't help think that bad chemicals, sugars, and processed foods, along with all the hormones that are found in the foods we eat, have to play a part in the cancer status.
Absolutely. On my list here as well, to prevent, I'm sorry, I just hit the mic, is to avoid white rice, to avoid sugar, those kinds of things.
And buy yourself a chicken to lay eggs, right?
Or not, which is what you do, right?
That's what I do.
Yeah. But we know that, according to research, that's not good. And so I think they're right on. That's exactly right. I think the message really is about being aware of the environment, being aware of what we're exposed to, but more importantly, being aware of what we're putting into our body. And then exercise is absolutely vital. So that's the message out there from a breast cancer preventative standpoint. And I think if we follow that, I think then we're on the right road. And I try to live by that as well. So that's good. There's a lot that I want to talk about today. We have the lines open. The first thing that I want to talk a little bit about is our wellness program at the hospital. As we're ramping up with the Gilbert Hospital and the Florence Hospital at Anthem, we have a wellness program that is specifically geared toward the employees. And I think that we just want to increase awareness on the importance of, again, exercise, yoga, relaxation, and taking a preventative approach and maintaining health that way. And so I think that's very, very important. I think we're going to be seeing more in the future from a healthcare standpoint of medical docs like myself, primary care physicians, really encouraging wellness, preventative, getting out there and doing things to help be one step ahead of the disease process, from high blood pressure, heart disease risk, all of those things. So I think that's really the mantra that we've got to stand in today.
Gotcha. Diane from Gilbert says, I juice daily, and I'm a cancer survivor 7 years now. and never was a veggie eater, I did also cut refined sugars as much as possible.
That's perfect. I mean, that's the challenge, is to cut refined sugar. For me, that's the challenge for me as well.
And refined sugar,
It's raw sugar. I mean, we want to try to avoid. Really, sugar does not have a good nutritional value. White bread, for example, is not really nutritious.
I mean, is the sugar that grows like sugar cane? What does refined mean? It goes through a mill, or?
Yeah, I mean, and that's exactly right. So we want to try to avoid that. People who drink coffee, for example, that dump in 3 and 4 scoops of sugar in their coffee, that's not healthy. And so those are the kind of things that we want to try to avoid. Eating candy. That's just raw sugar is just not good for the body.
You know what really scares me? And it's one of those things, you can read it and hear it all day long.
Yep.
The diet stuff. I mean, this is going to have a ton of aspartame in it, but I'd love to have a soda or a Kool-Aid or something, but instead I'm doing the Crystal Light. Is that... lab rats aren't liking it. I know that.
That's right. There's some studies showing that it's not healthy. That there's some carcinogenic effects from it, and so just talking about it, being aware of it, I think is the first step. I know for me, I used to drink Diet Coke, and I don't know, the last time I had Diet Coke was probably a year ago. So just being aware of it and then allowing your behavior to follow. One step at a time, is really all we can ask, and then that really leads you to living the wellness idea, and trying to preserve the body and staying healthy and those kinds of things.
No soda for you at all?
No soda for me at all.
So what? And you say a coffee a day is good?
Iced tea. Caffeine is good. In fact, people that follow our Facebook, there's some studies out, and there's a lot of research now looking at caffeine.
See, it's funny. My mother is on a specific no caffeine diet. And I don't know why. She's a breast cancer survivor. Would that have something to do with it? I mean,
last week we talked about it, and the question was posed to Dr. Budway, and and she said, and from the research that I've seen, I don't see that there's any negative effects of caffeine. In fact, they're finding now that there's a beneficial effect. There's some antioxidants in the caffeine that is beneficial for the body.
Plus, it speeds up your metabolism a bit, helps you lose weight.
You have to be careful. You have to be careful not to overdo it. You don't want to overdo. A cup of coffee is about 70 milligrams of caffeine. So you don't want to do more than like 200 milligrams of caffeine in a day, because of it revs up the sympathetic nervous system, and you don't want to develop palpitations and your heart rate racing and those kinds of things.
Fix one thing and hurt another.
So you've got to be careful. But I think moderation is really the message. I want to talk a little bit about the brain today. And I'm excited to kind of share a little bit about, how to preserve the brain, some exercises, as we, probably the biggest growing group of people are the baby boomers, this time. And, we hear a lot about dementia or early dementia or Alzheimer's dementia. And I got to tell you, just like we're talking about preventative for breast cancer and for heart disease and for diabetes and all of that, there are things that we can do that protect and preserve the function of the brain. And so, first of all, I just want to say that there's 2 sides of the brain. I tried to bring my little...
Your little brain?
My little brain today.
The one that comes apart?
Yes, and for whatever reason, I left the house.
We'll use the virtual one, right? The imaginary one.
Yeah, so for those of you listening, there are 2 sides to the brain. There's the right side of the brain, there's the left side of the brain. Most people are either right-brained or left-brained. There's some people that actually are kind of right in the middle. And I want to just kind of go through this and give you just a little information on what are the characteristics of a left-brain person and what are the characteristics of a right-brain person. And then I want to go through some exercises to share with you on what to do to help kind of preserve and what we call the neural connections in the brain. People who are left-brained usually are logical, they're mathematical, they're objective. They're people that are critical thinkers. So like engineers, even medical physicians, usually are left-brained. Right-brained people are the creative people, the artists, the musicians, more subjective, more visual, if you will, intuitive, and that's the right side. And if people who have access to a computer, you can go online and you can actually research out, right brain, left brain tests, and you can actually take a little test and find out if you're right-brained or left-brained. And Joe, it's really a neat thing to kind of do that, because it sheds light on really, kind of your personality and different ways that you can exercise the brain. For example, if you're left-brained and you are logical and you're that critical thinker, there are things that you can do that will exercise the right side of the brain, because usually you're using the left side of the brain most of the day. And just keep in mind that the movement of the body, for example, moving the right side of the body, you use the left side of the brain, and then vice versa. So things that you can do to exercise the brain would be to change hands. For example, if you're used to brushing your teeth with your right hand, do it with your left hand on occasion. And what that does is it really begins to exercise some of the, what we call the neural connections in the brain. And just think about, just different things that you can do. For example, if you use a computer and you're used to using the mouse with your right hand, move it to the other side. And that will be a good exercise, to exercise the brain. Drinking a cup of coffee or something, if you're used to doing it with one hand, do it with the opposite hand. That tends to help exercise the brain. I want to give the viewers out there just a little exercise. It's like a yoga exercise for the brain, okay? And John wants you to kind of join in too if you get a chance, okay? So those of you listening, just bring your hands out in front of your body, okay? And I want everybody to put their left thumb up and extend the pinky finger of the right hand out, just like this. If people are watching. Just like that. Now, change positions. So now you're going to extend the opposite thumb, and you're going to put the pinky finger of the other side out. And then if you just do that a few times, just alternating, try that. And you'll find that it's kind of difficult to do. And I'll just take a second and let people out there listening do that a few times.
I may be having some kind of mental problem here.
It's difficult to do.
Okay.
Think about it.
I just failed miserably.
Most people do.
Wow.
And it's amazing if you do that repetitively a few times a day. It really begins to, from medical research, from the research, just the way that the brain is wired, that a little exercise like that, extending the thumb and the pinky finger and then changing, really does help to engage the brain. It's called brain yoga, for lack of any
that's a
other.
real thing.
It really is. And, you can get music and you can kind of do it to music and really kind of get the movement going, because it's an exercise. It's strengthening, it's flexing the muscle, the brain muscle. And I think that's really a neat thing to do.
Is it true, and I learned this from CSI, I hear this quite a bit from television, oh, that person's having, dementia and this and that. Oh, no, it's not that. It's, I can tell that person's on antidepressants. Mm-hmm. Does that mess up the memory?
It does. It does. In fact, I'm glad you bring that up, because when I see patients in the hospital come in, there are certain things that if somebody comes in with an altered mental status or confusion, one of the first things we look for is infection. Especially in the elderly population, a urinary tract infection or pneumonia or something going on in the system can present simply just with a confusion, with a confused state. And so we have to keep that in mind. And so, that is something that we have to be aware of. Dehydration in and of itself can present with confusion, memory problems, and those kinds of things. So, keep that in mind. Another good exercise, reading is great, Sudoku, puzzles, all of that is very, very good for the brain. So the message really out there for those of you listening is to think about different things that you can do that consciously will exercise the brain to kind of keep it sharp. And, for example, if you drive to work and you go the same route every time, maybe take a different route. Some of the studies show that really kind of helps, again, with laying down different neural patterns in the brain.
Okay. What's your name?
There are 4 parts to the brain. There's the front of the brain, there's the top of the brain, there's the back of the brain, and there's the side of the brain. And the front of the brain, which is what we call the frontal lobe, is the part of the brain that is responsible for concentration. People who are, meditate or think very deeply, or, it's the seat of the will, for example. It's the front of the brain. The top of the brain is the part of the brain that is responsible for balance and movement. As we watch the Olympics and you see the floor exercise, these incredible athletes, their brain connection to the parietal lobe, which is the top of the brain, is so in tune that balance is perfect, posture is perfect, what we call proprioception of how the body is in relation to everything else around it depends on the integrity of the parietal lobe. And there are things that we can do to exercise that. The back of the brain, which is called the occipital area, is the part of the brain that is responsible for vision, for seeing. And we know that if you close your eyes and you visualize something, the brain doesn't know the difference of whether or not you're looking at it or visualizing it. It's called tricking the brain.
It's funny you say that. I just did an internet thing. A buddy of mine sent it to me, and there were 3 colors, and then there's a picture that looks absolutely like nothing.
Right.
And it's black and white, the picture. Well, you're supposed to stare at these dots for 30 seconds, these 3 colored dots, and then look really quick at the picture, and you do that, and you see a beautiful woman fully in color.
Yes.
That is amazing.
That mechanism is dependent on a healthy occipital lobe, which is where we see.
Oh, thank God I saw that.
In the brain, exactly. And so the reason I say that is because I want people out there listening to begin to think about things that you can do to exercise the brain. And that's exactly a perfect example.
Ray from Anchorage.
Alaska.
Much better temperatures there today, I'll bet.
Yeah, really.
43 years old, he said, I am forgetting a lot. I remember my childhood phone numbers, street addresses, all that, but I can't remember my schedule or even sometimes what I had for breakfast. Is there an herb possibly or something you can recommend to try to sharpen that?
It's a very, very good question. How I would approach that, and this is basically a general, I certainly don't make diagnoses over the phone, but when I hear people have, some memory loss or problems with that, I want to rule out things that are reversible. For example, I would want to make sure that, number one, you're not hypothyroid. I would want to check the thyroid, because if you have an underactive thyroid, Ray, that could translate into memory problems, sluggishness, those kinds of things. Number two, if you have a deficiency in vitamin B12 particularly, that's something that can translate into memory problems. And so those 2 things would be the first thing that I would want to make sure. Is your thyroid functioning normal? And, do you have a normal level of vitamin B12 in your system? And it's a simple blood test that can be done. Other things I would want to make sure is, are there any other neurologic problems? Is your balance okay? Is there any other things that would maybe make you think that there's something going on structurally in the brain? In that case, I would want to do a CAT scan of the brain, just to make sure that there's nothing from that standpoint. So those are kind of the easy, rule out kind of things that can be done. Fatigue. Interesting, we talked about sleep apnea in the past. People who have undiagnosed or untreated sleep apnea basically live the day in an oxygen deficient manner. And so if you think about it, you're not getting enough oxygen circulation to the brain. The sleep cycle is completely, out of whack, for example. And because of that, memory can translate into memory problems. And so that's the other thing that I would want to make sure, is to make sure that, that those things are addressed, because if that's the case, it's a very, very easy fix.
We've got Patty Price Wallace from New York says, B12, where's the best place to get our vitamins?
That's a good question. And I'm not a naturopath, and I don't, we don't supply it, and those kinds of things. GNC, is where I basically go for my, for vitamins and so forth. So I really don't have an answer in terms of, a recommendation from that standpoint. Now, there is something called pernicious anemia that I just want to kind of talk about, just so that listeners out there, there are some people who do not absorb B12 in the system. And so, if you are B deficient, B12 particularly, we want to make sure that you're able to absorb it. People who have had gastric bypass surgery or lap band surgery, what happens is B12 is absorbed into the body through a certain portion of the intestine. And whenever you have lap band surgery, a lot of times people are deficient because it destroys the integrity of the body's ability to absorb vitamin B12. And so in that case, a lot of times we recommend, vitamin B12 shots, because it gets right into the bloodstream. You don't have to eat it.
Those really help, huh?
Absolutely.
My wife used to get those, and I'd be like, wow, but I've never had one of those.
Well, a lot of people think that vitamin B12 shots are absolutely necessary, just for energy and so forth. And really, it's only indicated in those people that have pernicious anemia, where they're not able to absorb it, on their own, which is really an autoimmune process where the body destroys its own cells. It kind of destroys the integrity of the cells in the lining of the stomach, and as a result, you can't absorb it. And then those people that have had gastric bypass, for example, that can't absorb it.
Is that because they cut out a certain amount of the intestine or wherever, and then it just passes through quicker, so it doesn't have time to soak in?
It bypasses that area, within the small intestine. And so, the body is an amazing machine. There are certain areas in the body that, the top part, for example, the duodenum and the upper part of the small intestine has one function, and then down in the ileum and down into the colon, there's another function. So, different nutrients are absorbed into the body in different places. And B12 happens to be one that is absorbed into the body where the bypass, is oftentimes done. And so we find that a lot of times people who have had that surgery are deficient in vitamins. And that's a problem. So just keep that in mind from a memory standpoint, Ray. That's a really good question. Just, think about maybe trying to get some of that stuff done. And then the other thing would be to, do some of the exercises, really engage. Stress tends to, is destructive to the body. So whenever we're under stress, it's going to translate into, not being able to think clearly, not being able to remember things, those kinds of things.
Would you say that being under daily stress where you just really get upset ultimately takes days off your life?
It does.
Really does.
There's no doubt about it. It's interesting. I have some patients in the hospital, as we speak, and we were talking about stress tests. And, a lot of times people think that a stress test is a test that tests how the body deals with stress. And that's not the case. We really don't have that kind of a test. A stress test is really a test that shows how the body responds to exercise and whether or not there's a decreased blood flow to the heart muscle, suggesting, coronary artery disease. And so it's a misnomer. When we say stress test, it really has nothing to do with the amount of stress that we're undergoing. It's more putting stress on the heart so that we can measure it under that condition to see if, in fact, we have adequate blood flow to the heart muscle. And so, stress, chronic stress is absolutely destructive to the body.
Is that chronic stress?
Chronic stress, financial stress,
Wow.
People who are going through divorces, people who, lose loved ones.
Are there good stresses, though?
There are.
Do they still hurt you?
There are. Stress is good for the body. Let me just give you an example. If I were to take your arm and put it in a cast, okay, think about what's going to happen to the muscle in the cast.
It'll just degrade.
It's right. It atrophies. It weakens. And so, a certain amount of stress is absolutely vital for the body. That's why exercise is important, because exercise is really stressing the body, getting up and moving and keeping the muscles strong and those kinds of things. That's important. When we talk about destructive stress, we're talking about more emotional stress that it translates into cortisol levels and the chemicals in the body, the epinephrine and the norepinephrine levels being increased. And we know that high levels of cortisol, which is a stress chemical, increases the deposition of fat in the abdominal area. And so people who are under stress gain weight. Absolutely, we see that, 10 out of 10 times. And so part of the weight loss program should be stress management. That's why yoga-type exercises, Pilates, stretching, relaxation exercises is really important to be part of a program if you're interested in losing weight. There's some studies showing that in people that have had a heart attack, stress reduction, stress management programs reduce the reoccurrence of a heart attack by 40%. And so, now we as the medical community who have patients that have a heart attack and, those kinds of things are encouraging stress management type exercises and programs. I think that's very, very important. I want to just talk a little bit about something else that I right now have a couple patients in the hospital that I'm treating, and that is diverticulosis. We've talked about this in the past a few times, but I want to really get out the concept of what it is. Diverticulosis is a weakening of the muscle in the lining of the colon. And what happens is if you think of the colon, there's little balloons that occur, little pockets that occur in the colon. There's nothing we can do about it. It's an anatomical structure that we're born with. And as we age, it tends to weaken over time. There's some studies showing that red meat actually weakens the lining of the colon. And so people who have diverticulosis, diverticulitis should really avoid red meat if possible, or at least limit it in moderation. But a lot of people ask me, well, what can I do to prevent diverticulitis? I have this diverticulosis. There's nothing I can do about it. And my message and my comment is you want to avoid getting dehydrated. You want to avoid constipation. You want to make sure that your bowels are moving and that you have enough fiber in the diet. And the way to do that is to take a supplement maybe 2-3 times a week just to keep the bowels moving. Because if you think about if food sits in the colon, it has a longer time that it can actually get in those little pockets and set up an infection, and that's not good. So we want the transit time through the colon to be as quickly as possible. And everybody's different. Bowel movement patterns for people, are different. But, for individual people, you want to make sure that, that you have a nice regular bowel movement to prevent that, especially if you have diverticulosis. Seeds, popcorn, nuts, tomato seeds, anything that has that undigestible little particle in it.
Like kiwis.
You want to avoid. Absolutely. The little kiwi seeds, those are the things that you want to avoid and keep you out of trouble. I recommend something called Marilax. In fact, I just got done this morning talking to a couple of my patients' families about it, and we really went through step by step on what to do. Marilax is something great, or any stool softener that you can get over the counter to really help, keep things moving through. And, what I'm telling you, a lot of times your doctor may not have enough time in the office when you see them to kind of go through it. And that's really why I want to make sure that on DocTalk we get this information out, because it'll really help maybe prevent, a disaster or you ending up in the hospital.
Well, I've got some interesting news for you here that even is interesting to me.
Oh, good. Okay.
Rue from Melbourne.
Melbourne, Australia.
Melbourne. That's
wow.
the first time ever, I believe, we've gotten a call from there. And I asked him, how did you hear about the show? And he says, I just Googled medical advice.
Wow.
I'm blown away. I can't wait to do that. He says, with a very strong accent, I take St. John's wort. Does it really work? Doesn't seem to make me remember more.
Okay, that's a really good question. There were some studies early on.
St. John's wort?
St. John's wort. It's a supplement. And, again, I'm not a naturopathic physician. I'm a internal medicine physician, but I'm interested in really the integrative, because most of our patients who come into the hospital take things like, St. John's wort or saw pimento and some of these things. So we really have to know about that so that we can really best treat our patients. St. John's wort came out a few years ago, and it was really marketed as something for memory, to help even with depression. But for
straight
memory,
up for memory, huh?
That's how it was marketed. And I got to tell you, from the medical research that I've seen, it's not dangerous to take, but I've not really seen a whole lot of research to show that it does make a difference, that it's beneficial in helping to increase memory or strengthen memory or anything like that. So I don't really have a whole lot to say about it. I don't think it'll hurt you. I would recommend taking it in moderation. And the other thing is, if you have any other medical problems, for example, any kidney function problems, which is what I always ask, you want to be very, very careful of taking any supplements if your kidney is not filtering it out, because then you have the potential of that medicine, that chemical building up in your system, and that's when you can run into problems. So, so just be careful and be aware of that.
Makes sense.
Don't if a little is good, a lot is not necessarily better, and that's really a message. I see a lot of people come in, overdosing on medicines and not realizing it, when in fact they may be dehydrated, maybe they're taking some ibuprofen or Motrin, translates into kidney problems where your kidney's not functioning, and lo and behold, all this toxin builds up in the system, and that's not good. So just be very, very careful. Okay. I mentioned saw pimento, and I want to just talk a little bit about that. We've been focusing on women's health and breast cancer. I want to talk a little bit about men's health and the prostate. Saw pimento, on the other hand, has been proven medically to be effective in helping people who have an enlarged prostate. So, as men get older, the prostate tends to enlarge, and it's called benign prostatic hypertrophy. And what happens is that translates into symptoms where they get up and have to urinate frequently, at night and so forth, or feeling urgency. Be very, very, cautious that, number one, you want to make sure there's no infection. But, if all of that is rolled out and you have just simple benign prostatic hypertrophy, saw palmetto over the counter has been found to be very, very helpful. And it really works aligned with some of the other medicines like Flomax and some of the other medicines that really help with shrinking the prostate and helping those symptoms in men.
Got a question out there. It says, I've heard of students taking Adderall for focus and performance. Is it safe?
It is not safe. Absolutely not. In fact, it is a restricted prescription. And
is that the one for children with ADHD and all that?
Yes, it is. And I would be very, very cautious of that. And, especially in younger, youth and teenagers, I would be really cautious of using it unless it's directed by a primary care physician or a psychologist or a psychiatrist. It's very helpful in people who are diagnosed with ADHD or attention deficit. We have some patients on it, and it works very well. But I wouldn't use it just off the cuff as unless it's a diagnosed reason to take it.
I just realized how much I actually learn on CSI.
There you go. See that, Joe? That's good. That's very, very good. And that's another thing where people who present with, having a hard time focusing or feeling like, memory is not quite there, there may be something else going on. Clinical depression can be a diagnosis, and once that's treated, then you feel better. The memory gets better. Attention deficit, ADHD, again, same thing. So I think that it's important to really be seen, by a primary care physician, get the complete blood work done, and do it the right way rather than just trying to piecemeal it. And, because I think you might be running into danger if you do that. You have another question up there?
So, okay, here we go. I just finished 2 months of antibiotic for prostatitis. Mm-hmm. It seems to have worked. Should I go back and check just to be sure that the problem is solved?
Okay, that's a good question, because I wanted to get to prostatitis. Basically, prostatitis is an inflammation of the prostate. A little bit different. Benign prostatic hypertrophy is just a normal process of when the prostate enlarges and gives you the symptoms of having to get up and urinate a lot at night. Prostatitis is oftentimes due to an infection, a bacterial infection. And we treat it with, just as the comment was, a couple months of antibiotics, because there's not a lot of blood flow to that area. And so when you think about it, when you take an antibiotic, we want to make sure that it penetrates to that area, that you get enough blood flow there. You want to get the antibiotic to the site to clear and eradicate it. So we recommend treating for prostatitis for at least 1 to 2 months. So the first message is anybody out there that has prostatitis, and let's say your doctor only gives you 5 days of an antibiotic, that's not enough. We go by symptoms, though. So if you feel better, the symptoms are better, you're hydrated, you don't have burning, obviously there's no blood or anything like that. A lot of times we just, we recommend maybe a repeat urine to make sure that everything is clear, and then beyond that, there's really nothing else that needs to be done. In just continuing the idea of prostate, I want to talk about the PSA, which is the tumor marker for prostate cancer. And there's a lot of controversy around the PSA. We do it as a screening, from the age of 40 on or 50 on. The recommendation is depending on, risk factors and so forth, as a baseline, and then, recommend to kind of monitor and follow it. There's a whole body of thinking right now, a whole school of thought that says, we really don't even need to do a PSA, because what happens is prostate cancer, unlike breast cancer in women, prostate cancer is really not dangerous for the most part, in the majority of people, where it's going to impact mortality. So there's a whole school of thought that says, we don't even recommend doing it, because when we do it, and if it's a little bit elevated, then it's going to maybe make us, go ahead and do a biopsy, which ends up increasing the risk of infection and so forth.
And you get stressed out, which makes you all messed out.
And then in the long run, it really doesn't impact longevity, because the thinking is, and we know this, and we've known this from the start, that if men live long enough, eventually they will get prostate cancer.
Really?
Absolutely.
100% of the time?
There's some recommendations, or there's some studies that do show that if men live into their 90s, late 90s, chances are they're going to have a low grade type of, and I don't even like to call it prostate cancer, but that's what it is. It does not affect life mortality. It doesn't cause people to die or anything like that. So it's just kind of the normal aging process in men, and people listening out there can kind of research this a little bit. But it's an interesting thought. There's another school of thought that I happen to be aligned with, which is I tend to like to be more preventative and proactive. So the recommendation in the population of patients that I see in the clinic is that, yes, I would recommend doing a PSA, because in that small subgroup of people, we can actually make a difference. Because prostate cancer in some people, particularly African American men, it can be very aggressive, and it can spread and those kinds of things. But for the most part, prostate cancer is not really a huge threat to mortality. And so for men, that's good news, actually.
Got a question from Candy out of Los Angeles.
Okay.
She says, I sweat profusely when I eat.
Mm-hmm.
I'm type 2 diabetic, and I take Cymbalta and Wellbutrin. Also for anxiety, as needed, Klonopin. I do not drink, but I hate sweating.
Okay. Did she say how old she was? Okay.
No.
There's that.
I can guess.
There's that
30 to 50.
There's that perimenopausal time when women whose hormones are kind of fluctuating. And it's what we call vasomotor. They're hot flashes. And some people, for whatever reason, when they eat, especially in diabetics, tend to sweat more. There's really not a whole lot that we can do about that, other than some recommendations. Vitamin E has been found to be helpful for that. But again, we have to be careful with vitamin E, because it could, increase the risk of bleeding and those kinds of things. So
what about eating in a cold place? Are you going to sweat? That wasn't really a joke.
That's a good question.
Are you going to still sweat if you do that?
Probably not. Probably not as much. But a lot of times it's from the inside out, and so regardless of what of what the temperature in the room is, that's going to happen. If take note. Are you drinking anything like coffee or hot tea or anything at the time? Because that can increase temperature, and you can sweat. But for the most part, it's more hormonally mediated. Metabolically mediated, and I would be very cautious. People who have hyperthyroid tend to sweat more, and interestingly tend to sweat more when they eat. So that might be something that I would want to look into. Is the thyroid normal? Or are you possibly, overactive? Or if you're on thyroid medication, maybe you're on too much. Those kinds of things.
You know what I think of when I see people really, really sweating?
Mm-hmm.
I think of pain pills.
Yeah, not necessarily, though. Not necessarily.
See, I'm not a doctor, so so don't listen to me.
How we treat vasomotor symptoms of like hot flashes and those kinds of things, there's something called clonidine. And it's interesting, again, listeners out there, if you've ever heard of it, we use it for blood pressure. It's a centrally acting blood pressure medication. It comes in a patch, a catapress patch. And there were some studies showing that just a simple, very, very low-dose catapress patch, which is the TTS1 patch, if you put it on, it lasts for a whole week. That tends to, because it's centrally acting, it tends to mediate and calm down that vasomotor response. So in this person that just called in, if she came into my office, that would be something that we would want to talk about. A patch, putting it on as long as the blood pressure can handle, and it would help. And at the TTS1 dose, it's probably not going to cause any decrease in the blood pressure a whole lot. And that will probably help to eradicate those symptoms.
Do you worry about prescribing patches only because maybe people might forget to take their old one off and put another one on? Or do they run out?
They run out.
Oh, okay, so they do run out.
Just like when you take a pill and we say, you take it once a day or twice a day, in that time, within 24 hours, we know that medicine is no longer in the system active. That's why you're ready to take the next one. Same with patches. There are some patches that last for 3 days. There are some patches that, like nicotine patches, that are 24-hour type patches. After 24 hours, it's pretty much gone. You're ready for a new patch. Same thing with this clonidine patch, which is a week-long patch. It just gives, subdermally, just medicine, little bits at a time. and one thing I want to say about people who are listening again that maybe are on patches, some people develop skin rashes or, irritations when they put a patch on the skin. How we treat that, and it's interesting, if you put like a steroid is a really good topical kind of an ointment to put on the skin if you have an irritation.
What was it again?
Hydrocortisone.
Hydrocortisone.
Like steroids that you can get over the counter. But if you put a patch on the skin, you don't want to put a ointment or a cream because then it makes it moist and the patch is not going to stick. So what I've done, especially when I had my office practice and I would see a lot of patients like this, I would get the asthma inhaler. And this is really a pearl for you guys listening out there because this is something that, I'm not sure is mainstream, but I think more docs are using it now. But just kind of follow along with what I'm saying. The asthma inhaler, we have a steroid inhaler that comes in a aerosol. And so what I would recommend a lot of times is to get that aerosol, just spray it on the skin. It would basically stabilize that mast cell response. And then when you put the patch on, you get no irritation.
Wow, that's the tip of the day.
It is the tip of the day. So, especially if people who are dealing with that problem, it's irritating. A lot of times you need the medicine, it's in patch form, and then you have to just deal with the redness and the irritation that goes along with it. Well, this is one thing. It's the Flovent inhaler or the steroid inhaler that we get. It's a very simple fix. So I just wanted to kind of throw that out there. Any other questions, Joe?
No, just getting some comments out there like wow and things like that.
Okay.
I have a tip.
Okay, what do you got?
For the scuba divers out there going out to the ocean, great time of the year to do so, especially up there in California. Jellyfish. I got nailed by dozens and dozens one time, and thank God I was on a boat with people that knew what to do. They loaded me up with meat tenderizer, Adolph's meat tenderizer. They rubbed it all over me, and it neutralized the stings.
Wow.
There was my tip of the day.
That is
my non-medical tip of the day.
That's a good tip. There's, there's a lot of interesting medical kind of like home things that you can do. For example, I know people who have blisters on their feet. Okay, like if they wear sandals this time of the year and you get blisters. A really good thing to do, for that, sometimes people want to put creams on it and so forth. But chapstick, the chapstick that you can get, if you put that on there, that tends to work very, very well, to help it. So there's a lot of different things that, that we can talk about. I want to get back to the brain exercises because I think, there's just a couple more things that I want to get out. Sign language. Learning any language is really, really vital. It's a great thing to do if you want to exercise the brain muscle. And so, learning a new language is good to do. But a lot of people forget about sign language. And I want to just give people out there just an example. Right now, God bless America, I'm going to show you how to sign that in sign language. And what I want to do, we were talking about the different parts of the brain. When you sign something, it literally engages the 4 parts of the brain, especially when you visualize what you're signing. Okay, so just kind of follow along with me. The sign for God is just a simple gesture where you raise your hand up and bring it straight down, just like that. Okay, the wrist kind of moves. And those of you listening at home, I hope you'll do this with me. The sign for bless is just to visualize just something coming down from above, with your fingers spread wide apart. If you have arthritis, this is a great exercise to do.
I missed that.
Okay? Just simply your hands are up underneath your chin, and you just move the hands straight down. But the interesting thing here is that you want the integrity in the muscles to match, what you're thinking. So it's not just kind of a weak movement. You want it to be intense, where your fingers are spread wide apart, as if rays of light were coming, down from above. And lastly, the sign for America, and this is interesting. I want you to visualize a white picket fence surrounding a farmland. And the picture of that, the sign gesture for that is to interlock your fingers loosely and just move your hands across in front of your body. And that's the sign for America. So, when you put it all together, it really becomes like a dance or like a form of connecting words together. But what it does more than that is it really exercises the brain, and it really helps with memory. And then when you bring music to it, then you're actually adding a whole nother part of the right side of the brain. So it's just another way that you can, exercise the brain. While we're waiting on a call, I want to talk about blood pressure again. Over 30 million people are diagnosed with blood pressure a year. And, I can't tell you how important it is to make sure that the blood pressure gets checked. I was just in the hospital probably a couple weeks ago, and one of my colleagues just wasn't feeling well, and, out of the blue, did a blood pressure, and the blood pressure was just off the wall. So, I said, when was the last time you had your blood pressure checked? And he said, I don't know that I've ever had it done, within the last couple years. And here is a physician who's practicing medicine, who's a surgeon, who, we've got to be very, very careful, again, to protect and to prevent bad things from happening. Knowing what your blood pressure is probably one of the most important things that you can do, because elevated blood pressure is a silent killer. It doesn't hurt. It doesn't give you any symptoms.
And
so just be aware of that.
My father was on blood pressure medication for 10 years until they found out he did not have high blood pressure.
Really?
They were always testing him with too small of a cuff.
That's another good point. Make sure that the size of the cuff is good, and also make sure that when you do get your blood pressure checked, to do it on both sides, because there's a small subset of people, maybe 10% of the adult population, who have, an aberrant, it's kind of a medical term for, the vein in the upper arm, and the blood pressure in one arm may not equal the blood pressure in the other arm. And so you want to make sure that you have it checked on both sides, and just make sure that that's brought to the attention of your physician, because, that's important to know. Because you could be checking one arm, and it may be, completely normal, or it could be real high, but really, in effect, that may be a stenosis.
Wow.
When, in effect, you have... and that can bring symptoms of dizziness and lightheadedness if you're on medicine when you really don't need it.
And you shouldn't feel guilty asking your healthcure provider, can you please take it with the other arm?
Absolutely not.
Because you may feel a little funny at first.
Absolutely not. That's a great point. You should never feel funny or be embarrassed about anything when it comes to your health. And so...
and if your doctor, and if they treat you like that, find someone else. There's a lot of healthcare providers.
That's exactly right. That's exactly right. And I think more and more people are, standing in that.
Michael Ross of Gilbert says, and boy, I can sure appreciate this one because I suffer with this too. Terrible hand cramps. He says he gets them daily, and his hands also feel a bit swollen, quite a lot. No arthritis. He's 56 years old. I was told to take chondroitin. What should I have checked for? He's been to the doctor several times, and that's all they pretty much tell him.
Okay. Cramps. Well, first of all, chondroitin, glucosamine is not the treatment for cramps. If you look at the pathophysiology of what a cramp is, it's usually mediated by a muscle. It's a muscle, ligament, tendon. Chondroitin, glucosamine really are directed toward cartilage and bone. So that's number one. One of the things that you want to make sure of is there an electrolyte imbalance? You want to make sure that magnesium, calcium in particular, potassium, those are the things that you want to, check. People who are on diuretics, for example, and I don't know if this gentleman is on a blood pressure medicine, a diuretic, where it depletes the body from sodium and potassium. One of the things that we see as a side effect of that is cramps, especially in the hands and in the feet. And so that's the first thing. It's an easy fix. You want to make sure that you replace magnesium, calcium, potassium. The other thing that we recommend, once that's all rolled out and everything in terms of the blood work is normal, tonic water has quinine in it. And a lot of times what I recommend to my patients is quinine, because quinine acts at the level, at a cellular level, to help with the transport of electrolytes across the membrane that are responsible for causing cramps. And so, there are quinine tablets that are used. A lot of times dialysis patients, we recommend that.
And what I was told when I went and saw the doc for my hand cramps, and now after talking to you, it's ridiculous. Oh, drink more Gatorade. Well, that was making me feel like I was retaining a ton of water.
Right. That's not the thing, because Gatorade is packed with sugar, and that's not good. If you're going to do anything like that, you want to, directly target it to whatever electrolyte is imbalanced. Is it the sodium? Is it the potassium? Is it the magnesium?
Wow.
Calcium, a lot of times people don't take enough calcium in their diet, even though, we would have to drink, I don't know how many gallons of milk in order to get the daily allotment of of calcium a day. A great way to get calcium is through Tums. If you need a supplement, there's the Ozcal.
And they don't taste too bad.
They don't taste bad. You chew
Pretty
them,
good.
but it really gives you the bioavailability within the body, so that the body can take it and use the calcium. But I was talking about tonic water. A glass of tonic water has quinine in it. Maybe put a little bit of lime, a little bit of lemon. The citrus actually helps to transport it and makes it more available in the body. And that's a really good fix for people that have, just simple cramps.
Does it mess it up when they add the gin?
Well, that's another story.
I'm
That's
just
a
kidding.
whole different story.
Patty out there in New York says, my husband is older than me, and he went on meds for high blood pressure. He tried finding the right one. It took him months. And now apparently her blood pressure always runs a bit high and dreads the thought of the side effects that come with it. Is that she doesn't feel bad when it's high?
Right. Right.
Is it normal for some people to have it running high?
Most people don't. We have to, number one, do you have what's called white coat syndrome? People who walk into the doctor's office, just driving up.
Scared of you.
Blood pressure goes up. And it happens without their consent. It's an automatic kind of response. Some people just, for whatever reason, blood pressure goes up. It's called white coat syndrome.
Now, I have to say something because I happen to know Patty, and I believe she's an upper level police officer.
Okay. Mm-hmm.
I mean, that would do it for your blood pressure right there, wouldn't it?
Yes, it would, but there's no excuse for walking around with elevated blood pressure, mainly because the sharing forces in the body literally are destructive to the body. High blood pressure translates into blindness. I mean, it affects, if you think about it, it affects the little tiny vessels in the body first. So people on dialysis, a lot of times, people with uncontrolled high blood pressure eventually end up on dialysis because it destroys the integrity of the blood flow to the kidney. People end up with, retinopathies and visual problems because of that. Heart problems. Obviously, it puts an unbelievable strain on the heart muscle. And that's why it's really important. There's no reason, especially today, in our country, we have, in my opinion, the best medical, medicines that's available. And so they're very safe. I would not hesitate one bit to be on a blood pressure medication. And there are different ones, so we can tailor it to depending on how people tolerate it.
So Patty, make sure you look into that and get that corrected.
One thing that I want to just say, and I can't believe we're almost out of time, Joe. It's unbelievable how quick this hour went.
Wow.
But the comment that I want to make in terms of blood pressure is that fluctuations in blood pressure oftentimes are more dangerous than if it's just running at a constant level. Running at a constant high is not good. Obviously, it puts strain on the heart. But what's even worse than that is when people say, well, my blood pressure is normal at times, but then when I'm stressed out at work, it goes way up. Well, that sharing force of the up and down, it's called the delta, the change in the blood pressure is really, really dangerous to the body. That's when strokes can occur. And we know that, strokes are one of the side effects that occur when the blood pressure is out of control. So the message is really, again, I think this whole time today, we were talking about wellness, preventative, thinking about how to prevent breast cancer best, how to prevent strokes, keeping your body healthy, keeping the brain healthy. So those are the things that we really want to talk about. I don't know. I think we have another question. Maybe we can take one more. Okay. Oh,
no, we're good.
Okay. Well, I think we're out of time, Joe. This has just been a very, very quick
It
hour.
went by very quick. I didn't even realize it was half past the hour.
I know, me too. And I just want to tell you, we have some guests lined up over the next couple of weeks. We have a doctor local here who is a specialist in pulmonary hypertension and lung transplant. And I just confirmed today that he will be on the show in 2 weeks. So we'll make sure that we get that information
That has
out.
got to be amazing.
It's going to be a great show. Yeah.
Lung transplants. Wow.
Yeah, from down in Tucson. So we'll be talking about everything about transplantation and so forth. We're going to be getting a veterinary talking about animals and pets and the health of our pets on the show.
And we're starting a veterinarian show right on the station.
Really? Oh,
so I'm looking forward to a surgeon.
Okay.
I've got a surgeon that's going to be
great
doing a show. So this is exciting. Everybody loves their animals.
Good.
No, I do.
I do too. So stay on. If you haven't liked us on our Facebook page, please do that.
Yes, and that would be facebook.com/DocTalk Radio.
Great. Well, thank you guys for listening. We'll see you next week.
Why is it so hot in this room, yet cold in other rooms? There's got to be a solution.
You need to call the company.
Perfect time. This concludes DocTalk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
DocTalk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.
Life can be tough, and good people can face great challenges. My name is Mark Windsor, and I'm an experienced attorney and counselor at law. I've helped many